am Aisa Hamza, BSN3 at University of Mindanao. And today I am going to demonstrate the procedure for assisting a client to ambulate. Ambulation is defined as moving a client from one place to another place. The purpose of assisting a client to ambulate: first, to keep the client more active; second, to improve the muscle tone and strength the lower extremities; third, to slow loss of bone mass and density related to osteoporosis; fourth, to promote peristalsis and circulation; fifth, the client get a sense of accomplishment and maintaining a great independence. The equipment needed is first gait belt as necessary, second non-skid shoes or slippers, third non-sterile gloves and the other PPE as indicated, fourth stunt assist device as necessary if available, and the last one is additional staff for assistance as needed. Before that, I am going to do an assessment, which is to assess the patient's ability to work and their needs for any assistance while doing the procedure, and review the medical record and nursing plan of care for condition that may influence the client's ability to move, and ambulate assist for two IV line incision or equipment that may alter the procedure for ambulation, and identify any movement limitation. Identify the client and explain the procedure to the client, and ask the client to report any feelings or dizziness, weakness or shortness of breathing, because identifying the identification validate the correct client and correct procedure, and explaining the procedure is to allay anxiety and prepare the client to what to expect. Good day po, ma'am. I am Isa, your student nurse today. Ma'am, can you please state your name?
I'm Hasmin Hamza, November 9, 2000.
Thank you po, ma'am. So, ma'am, I will perform the assisting ambulation kung saan po ililipat kayo sa kabilang place po. It's okay po, ma'am?
Okay po.
So, kapag po nakaramdam kayo ng pagkahilo, panghihina, or paninikip ng dibdib, sabihin niyo po.
Okay po.
Place the bed in the lowest position. So the rationale for that is proper bed height. Ensure the safety when getting the client out of the bed. And then encourage the client to make use of a stand or assist aid, either freestanding or attached to the side of the bed. If available, to move the side of the bed, assist the client to the side of the bed if necessary. And the rationale for that is to encourage independence of the clients and to reduce the strain for staff and decrease the risk for the client injury. Have the client sit on the side of the bed for several minutes and assist for the dizziness or lightheadedness. Have the client stay sitting until he or she feels secure. The rationale for that is having the client sit on the side of the bed minimize the risk for blood pressure changes such as hypertension, and that can occur with the position change, allowing the client to sit until he or she feels secure, reduce anxiety, and help prevent injury. Assist the client to put on non-skid or slipper resistant footwear, and the rationale for that doing to ensure safety and client warmth. Apply the gap belt snugly around the client wrist. Based on assessed need to facility policy, the rationale for that is gap belt improve the caregiver growth, reducing the risk for musculoskeletal injury to staff and the client. The belt also provides a firm grasp for the caregiver if the client should lose his or her balance. Assist the client by standing in front of the client, grasping each side of the gap belt, keeping back straight and knees bent. Use of the get belt to prevent injury to the nurse and to the client. While holding the belt, gently rock back and forth 3 times. On the third time, pull client on the standing position. This action provides movement to the help of client into a standing position. Once the client is standing and feels stable, move to the unaffected side and grasp the death belt in the middle of the back. So, standing to the side of the client provide assistance without blocking the clients. So, if the client does not require a get belt, place hand closest to the client around the upper arm and hold the client's hand with your other hand and assist the client balance and leg strength. If the client is weak or unsteady, sit the client back down on the assist to a chair. So the rationale for that, assessing the balance and strength of the client is help to identify the readiness for ambulation. Begin walking, matching your step to the client and instruct the client to look ahead and left each foot off the ground. Mobilize joint of the lower extremities, improve the muscular skeletal coordination and muscle strength, and improve the exercise performance. Nursing assisting, position to the side and slightly behind the client. Support the client by the waist or with the transfer belt. The rationale for that, positioning the client side and slightly behind the client, encourage the client to stand and walk erect. It also places the nurse in a safe position if the client should lose his or her balance or begin to fall. Take a several steps forward with the client and continue to assist the client's shift and balance. Remind the client to stand and the rationale for that. Taking the several steps with the client and standing erect, promote good balance and stability, continue to assessment, and help maintain client safety. Ambulation for the planned distance and time. When the client is finished ambulating, return the client to the bed or chair based on the client tolerance and condition. If the client returned to bed, place the bed in the lowest position, raise side rail as required, and ensure the call bell is within the reach of the client. The rationale for that, ambulation as prescribed promote the activity and prevent fatigue. It's allowing the client to rest after the ambulation and help to prevent fatigue. Remove the get belt of the client and clean transfer aid per facility policy. If not indicated for single client use, remove the gloves and any other PPE. If used, perform hand hygiene. Finally, for that is proper cleaning of the equipment between the client use, prevent the spreading of microorganisms. Removing the PPEs properly reduces the risk for the infection transmission and contamination of the other items, and hand hygiene prevent the spread of microorganisms to the client.
The last part is documentation. Document the activity and any other pertinent observation to the client and the tolerance of procedure and the distance walk, and also document the use of transfer aid and the number of nurse staff required for transferring. So the rationale for that is to provide a baseline of the client ability and promote a clear communication and to the healthcare provider.